So good morning, a great Monday morning, Black New Mexico. I'm Scott Carruthers, Executive Director from the New Mexico State Office of African American Affairs, where we provide change by means of support, advocacy, and resources that are relevant to the African American community. Today is another Monday morning podcast where we will continue to discuss issues African Americans in New Mexico are facing while navigating through the COVID-19 pandemic. I want to acknowledge and thank Ms. Sonia Smith from the Department of Health, who you will hear later in this podcast, and her team for partnering with OAAA staff and providing free testing this week, and also Mr. Jacobs for the use of the facility. They provided free testing, you all, so please, if this arises again, please take advantage of it. But again, Ms. Smith will be on later to discuss this in further detail. Also, a big thank you goes out to New Hope Church and Bishop Cooper for providing groceries to the community with the importance of the census and COVID-19 information. Thank you for the work that you're doing with the Office of African American Affairs in this endeavor. Finally, prior to turning this over to our facilitators, always know there is a COVID hotline that you can call at 1-855-600-3455. It is my pleasure now to turn this podcast over to our esteemed facilitators, who will also have special guests today, Director Harvey, Director Covington, and Vice Chancellor Martin. You all please stay safe and stay healthy, and may God bless. Thank you.
Thank you, Scott Carruthers. Thank you for to the New Mexico Office of African American Affairs for being able to bring in yet another important podcast, particularly during these difficult and challenging times. My name is Jim Harvey, and I am honored to be one of the co-facilitators of today's discussion, along with Dr. Jamal Martin and Tanya Covington. Before we go to our key presenter today, let me turn it over to Sonia Smith of the New Mexico Department of Public Health, because I think she's got some really, really important information that we'd like to share before we get into Dr. Cooper's presentation. Sonia Smith, welcome and thank you for joining us today.
Hi, good morning, everybody. It is really good to be here. I want to certainly thank the Office of African American Affairs and you too, Jim, for allowing us the opportunity to come in and talk about what the governor has instructed us to do, because she takes the health of New Mexicans very importantly. So also with the Secretary of Health, Secretary Conco. So we are just excited to have this opportunity to talk about what the plans are for the Black community. So again, I'm Sonia Smith, and I am the Special Projects Coordinator for the Secretary of Health, for the Department of Health. And I've been in this role for a couple of months, so I kind of hit the ground running, and I'm really excited about this. It is ambitious, but if there's one thing we know about our people we are ambitious and we get things done. So we had a really good testing drive down in Hobbs a couple of weeks ago, where we tested 179 people. And of those 179, 106 were actually African American. And I'm proud to say that everybody was negative. So yes, testing matters, testing counts. We also had another successful drive this past weekend with the Elks Lodge, and shout out to them for being so hospitable and letting us come but I will have that shortly. And then I'm also hoping that we will also see more negatives. But before we move on, if I will, I would like to talk about another drive that we're scheduled for this weekend on Saturday at New Hope under Bishop Cooper. He's going to allow us to come and set up there, and we're going to target about 200 people for this event. So we have set, again, a very ambitious goal to test 75% of the African American across the state. So that's my task. So I'm going to need a lot of partners to make this happen. So I'm counting on the community to let me know where we can go to do this. And I'll be glad to share my information later on where they can email me or text me or call me directly and say, hey, we want to do a testing drive here, because it is important that we know our numbers. So that's it. Thank you.
Sonia, thank you so much for that important information. And I hope everybody will take advantage of the testing sites and testing schedules as they come available. We do have one question that relates to testing, so I invite you, Sonia, as well as Dr. Cruz and Dr. Martin and Tanya Covington to also chime in on this one as well. And it's a question about testing the homeless. And the question is, has anyone confronted the governor or mayor concerning how to test the homeless? And with that mandate that everyone should be wearing masks, shouldn't masks be provided for them as well? I believe this is urgent. It's an urgent concern. And our homeless communities, which are everywhere, could very well have the virus and could easily pass it on to anyone. So can anyone tell us what's going on in terms of testing for our homeless or unhoused communities?
I can start, and then my colleagues can certainly join in. I do know that we are working very closely with the city on this matter, but not just here in Albuquerque, but across the state. So we have collaborations that are ongoing. We're working with people who have volunteered their time to sew masks, and giving out masks to people, and we are testing. So there might be some other people who want to chime in as well.
I do know that here in the Albuquerque area, the city of Albuquerque, as well as the medical corps, have been testing the homeless right since the very beginning of this. They've gone to homeless shelters, they've gone to parks, and they have been testing the homeless and handing out masks. So that is well on its way.
Anyone else? Just let me add, I did talk to the chair, my boss, at the Albuquerque Center for Peace and Justice over the weekend, and she told me that she has an offer to receive free of charge up to 10,000 masks. And if that happens, those should be in a matter of the next few days. If they come in, we're going to make certain that those are available in areas where they're needed as well. So just stay tuned, and when that delivery comes in, I'll be making an announcement everywhere I possibly can. All right.
Can I add something also too?
Sure, Jamal. Thank you.
Regarding the testing for the homeless population in Albuquerque, it's important to remember that the Westside Emergency Housing Center for COVID-19 is open 24 hours until further notice.
Good to know.
So individuals, who need testing, there's a possibility there.
Fantastic. We can make referrals to them as well?
Mm-hmm.
Great.
Mm-hmm. Primarily for the homeless, but yes.
Okay, good. Well, that's good to know, because some of us are engaged in providing other services to homeless populations as well. And so being able to make that critical referral at this particular time is really important news. Mm-hmm. So thanks for that. Okay, so I just want to take a point of personal privilege. I'm introducing a new 30-second segment called Myths and Misinformation. And that myths and misinformation is designed to just address some of the wild and crazy stories that we're getting out here. And I encourage everyone to always feel free to check information for yourselves to make certain that you're getting correct information. So today's myths and misinformation. Opening up for business does not mean that the virus is gone or going away. You're encouraged to please continue to practice social distancing and wear your mask. Second, a vaccine is not imminent. And the last one, that's a point of information. The US makes up 4.3% of the world's population, but nearly 30% of the COVID-related deaths to date are in the US. Makes you think then, so how great of a job is our federal government really doing at this time? That's it for that point. Now it gives me great pleasure to introduce to you our key presenter for the day, Dr. Mario Cruz. Mario Cruz is a clinical professor of psychiatry at the University of New Mexico School of Medicine. Dr. Cruz is also an associate chief medical information officer for the University of New Mexico Health System. He's director of quality and informatics at the Department of Psychiatry and Behavioral Health Sciences at the University of New Mexico School of Medicine. And he is the medical director of the Recovery and Resilience Program at the University of New Mexico's Health Center, Mental Health Center, serving individuals with depression, anxiety, and histories of severe post-traumatic stress disorder. Dr. Cruz held several positions in community and academic institutions throughout the country, including the Chief Medical Officer for the Department of Psychiatry in Arizona Health Sciences in Tucson, Arizona. He was Vice Chair for the Clinical Services in the Department of Psychiatry, Arizona's Health Sciences Center, and co-investigator in the Advanced Center for Intervention and Services Research, Late Life Mood and Anxiety Disorders at Western Psychiatric Institute and Clinic. Dr. Cruz has published over 30 peer-reviewed articles and book chapters on issues related to the delivery of mental health services to the poor and underserved. And I need to add that he is president of the New Mexico Black Wellness Coalition and is currently, I believe, the only Black psychiatrist in the entire state of New Mexico. When do you sleep, Dr. Cruz? Proud to hand this over. Let me hand this over to Dr. Mario Cruz and welcome.
Start my video. Well, thank you, Jim. And I'd like to thank the Office of African American Affairs and the New Mexico Department of Health for having these podcasts to the public at this time. This providing hopefully as objective information as I can will help you be able to make the decisions that you need to protect yourself, your family, and your community. So could start the slides. Thank you. The coronavirus infects people and causes the coronavirus disease called 2019. We initially thought it affected only the old. Next slide. Please, next slide. But it also affects the young. Next slide. And it affects both men and women combined. So this disease crosses the lifespan in terms of its potential impact on the health and well-being of all individuals, but in particular, the concern today is its significant and adverse impact on African Americans. Next slide. For instance, this came from the Center for Disease Control and Prevention called Cases in the US. These are 4 different states that had collected racial data on individuals who unfortunately had been infected with the disease and died with the disease. So the blue bar is the total population of that particular racial group in that state, and the orange bar is the percent of individuals who died from the disease. And as you can see, moving from right to left, from Illinois to Michigan to Louisiana to Wisconsin, the death rate of COVID-19 with respect to African Americans is significantly higher than our population in each of those states. Unfortunately, I don't have similar data for New Mexico to describe that at this present time. Next slide. Some of the reasons that we think place African Americans at greater risk than, for instance, white Americans is because of, on our left, our fair or poor health status done by the Pew Research Center. This was a household survey where individuals were telephoned and they asked questions about their health and well-being. African Americans had a significantly higher rate of saying that their health status was fair or poor. African Americans reported having a higher rate of being significantly overweight, to be described by the CDC as someone who is obese. African Americans had a higher rate of diabetes and also a small but significantly higher rate of asthma. Each of these illnesses, unfortunately, puts us at greater risk for having poor health outcomes related to having the virus. Next slide, please. Some other reasons are socioeconomic that put us at greater risk for exposure to the virus. For instance, we have an overrepresentation in low-wage essential workforce. Individuals working in group home or healthcare workers who work at multiple healthcare settings. Each of those settings puts that individual at greater risk of being exposed to the coronavirus and potentially contracting the coronavirus. African Americans throughout the United States have higher housing density, meaning the number of people who live within a household. And this makes it difficult to then practice social distancing, therefore increasing our risk of exposure to the virus. And African Americans have a overrepresentation in what are called, quote, congregate settings, that being in homeless shelters, where throughout the United States, we represent 40% of all individuals who are in homeless shelters, and we represent 33% of the federal and state prison systems. Next slide, please. So we have potential risk factors that, both from a social standpoint, an economic standpoint, and a health standpoint, that put us at risk for, one, having greater exposure to contracting COVID-19. And if we do contract COVID-19, we have a higher rate of death than the white population in the United States. Now, this presentation, I wanted to start with some of the physical health issues, but this presentation is going to focus more on some of the mental health impacts of living and experiencing the coronavirus pandemic. Next slide, please. COVID-19 has different effects on different people. And for us, we have individuals who previously have diagnoses of mental illness, and most mental illnesses for which they're treated by someone like myself are considered chronic. They are going to last with that individual for a significant period of their life. They will be able to manage and control it better, but we do not have cures for most illnesses at this time. And being in a COVID pandemic has significant impacts on their mental health and well-being as well. We have that COVID-19 has theoretically can create mental illnesses within people, and I will discuss those very briefly, but discuss because we haven't seen any of these true diagnoses that are related to having the virus itself. More than anything, COVID-19 can cause stress within the individual who has the disease and within the people who care about them. And last, the COVID-19 has not just had an impact on the health and well-being of Americans, it has had an impact, adverse as it is, on our social life and our economic life. These downturns in economies can cause major, significant rises in mental health issues, and they have occurred throughout since the dawn of time. And these are described as deaths due to despair. And I will go into some detail regarding those issues. Next slide. In terms of stress-related mental illness, next slide. When we're stressed, that means our body has identified that there is some external circumstance situation that we define as being adverse to our future functioning and well-being. That causes an array of different physiologic responses in our body, one of which is a rise in cortisol. Cortisol is the major hormone that allows us to prepare to fight or flee an uncomfortable or distressing situation. Yet elevated cortisol levels, if they're continued for an extended period of time, can have adverse consequences to an individual, such as problems with their memory. They may not be able to concentrate as well as they have in the past. That's what the second bullet, was on problems with attention and concentration. And more disturbing, this can have problems with people reading other people's emotions. So what someone may be presenting as a smile may be seen differently from an individual who's constantly in distress. And they are going to revert to what they think are stereotypic views of how people would react under those situations. And sometimes their reaction could be destructive. Next slide. Now, there was a study done by Shua and colleagues in Croatia just recently, looking at past pandemics and trying to put together what were some of the mental health consequences of those pandemics. In looking at the most recent pandemic that we had, the SARS virus, there was stigmatization of affected persons, stigmatization of health workers. And if any of you had read AP Press this weekend or the New York Times, you may have seen this report on healthcare workers throughout the world being beaten, thrown bleach on, being kicked out of their own housing as a result of fears that people have of them getting the virus from the worker, even though the worker was taking all safety precautions that were necessary. The other thing that happens when people are afraid and that fear moves to dread due to the uncertainty of what's going to go on, they attack authority figures. In this case, authority figures could be the New Mexico Department of Health. As we've seen in other states, governors are being attacked as a result of trying to ensure the safety of well-being of their population. There can be mistrust of the medical community and conspiracy theories. And just by the fact that Jim Harvey had to present common myths that he needed to dispel today, that is just one example of what mistrust can do to cause people to look for information in the wrong places, even though it was at the right time. I have one patient who has a very severe illness, and she called me in a panic because she saw on an alt-right newscast that the government, through vaccination, was going to implant in us nanotechnology to monitor our thoughts, behaviors, and actions 24 hours a day, 7 days a week. This woman never had, in my time working with her, anything close to having what we would call a psychotic experience, as this would be. How did I solve that? I simply spoke to her and said, you really should only be going to 2 sites if you're going to get health information at this time that are reliable. That being the New Mexico Department of Health website for COVID-19 and the Center for Disease Control and Prevention website. She has done that, and she has told me that her anxiety is a lot less. The other thing that can happen as people try to deal with their anxiety related to the uncertainty of whether they will get the disease, whether they could die from the disease, or whether family members or loved ones could get and die from this disease, they begin to have what are called panic attacks. Panic attacks are a signal by the brain telling us that there is a threat, and so we start to breathe fast. If we breathe too fast, we change what's called the acid-base balance in our bloodstream, which causes our heart to race even faster, which means it brings oxygen into our body, but too much oxygen. And as such, the person's brain then says, stop breathing. And it does stop the lungs from breathing. But the individual psychologically says, oh my God, I'm not breathing. That means I'm going to die. This is a common illness in psychiatry that we treat, but it can happen due to the uncertainty and dread to individuals who never before ever experienced a panic attack, for which I'm treating one young man who works somewhere within the UNM health system for this very thing. He never had an illness before, and now he's begun to have these panic attacks. It can also lead us to try to maintain things in a very structured and formatted way throughout our days. We will see people start to clean obsessively and not be able to stop, because each time they stop, they feel compelled to start again. We can see people needing to order things, putting things in order, from glasses to dishes to knives to forks to spoons to their clothing, much more so than they have in the past, as a means of trying to kind of let go of their anxiety. Yet the anxiety and fear comes back, and so the symptom recurs. Last, due to social isolation, many people can begin to experience fear, anger, and frustration, some of which we're probably seeing in terms of some of the individuals who are protesting at the governor's palace, the governor's houses throughout the country, to force them to open society up. And last, individuals like ourselves can have loved ones who die from this illness, some of whom will watch it and witness it. And that's not counting all of the frontline healthcare workers who on every day worry that another person is just going to come in and die. ICUs filled with people who are placed in pharmaceutical comas to just breathe on a ventilator. That has to be an experience and a memory that can't go away and must be talked out, worked out, and spoken to someone else so they don't have to shoulder that themselves. Next slide. Now we go to individuals who have mental illnesses. Next slide. In the United States at this present time, we have approximately 2.2 million adults, meaning over the age of 18, who presently have a substance use disorder. We have 1.1 million people who have both a substance use disorder and mental illness, and we have 4.8 million people who have mental illness. This is a substantial number of individuals who unfortunately carry this burden, and these are all African Americans. Next slide. Those illnesses can be worsened as a result of the coronavirus epidemic. Sometimes their social isolation as a result of being stigmatized by having a mental illness may not be as big an issue as for the rest of the population. For many of the people that I continue to see on telehealth visits, when I ask them, how are you doing in terms of being isolated from family and friends? He says, that's like every day in my life. And so I think there's a darker issue that has arisen as a result of this pandemic, and that being that the mentally ill have been stigmatized to the point of being isolated from society for so long that somehow that issue has to be addressed in the future. But mental illness also carries the weight of increasing the risk of other health illnesses as a result of the medications that they're on, as a result of the illness itself, and as a result of the reduced activity levels that many of these people have, and the lack of good food available for most of these individuals in terms of where they live, such that mental illness can be a contributor to increased risk of heart attacks, obesity, high blood pressure, diabetes, and a few other diseases. And as I had mentioned before, for African Americans, and particularly in this case, African Americans with mental illness, they may be putting themselves at greater risk for, if they contracted the disease, unfortunately having an adverse outcome. Next slide. Now, there are putative possible mental health issues that are directly tied to the disease itself, some of which can be disorientation from getting a high fever and from being placed in an ICU for an excessive period of time. This is a well-known illness called ICU delirium. And it is not a small thing because individuals start pulling IVs out, can pull out their the ventilator respirator that's inside their lungs. And so this can become actually an adverse, serious event that could harm the individual in the long run. But in looking back at influenza epidemics, we have seen a rise in psychosis. And one of the putative predisposing factors to actually getting a diagnosis of schizophrenia is a mother in pregnancy having a cold or the flu. So this has been well known for some time. Some people believe that that this psychosis related to a virus can increase the risk in an individual 4 to 5 times greater than the general population. So having the COVID disease could also put you at risk for another problem that would have to be addressed from a psychiatric standpoint. Now, the most recent SARS epidemic, the coronavirus 1, suffered from 31 to 50 months after the infection itself. Post-traumatic stress disorder, depression, a pain disorder, panic disorder, and as I mentioned before, obsessive compulsive disorder. So we may have what's called the epidemic of mental illness that will arise as a result of this pandemic, and that epidemic will last longer than the pandemic itself. So we should be looking to shore up and increase the services that we can provide on the addiction and the mental health side of things within our health systems to prepare for this second wave or crisis that will occur as a result of the COVID-19 pandemic. Next slide. Now, as I mentioned before, there are adverse social and economic consequences from this disease. And it has been, and this has occurred, and all of these problems has occurred every time there is an economic downturn. The most significant one in the history, at least most recent history, has been the Great Depression. And in that time, even though the unemployment rate rose to the level that it is at this time, African Americans suffered more severely with that economic downturn than any other racial group. And my worry is that again will happen with this socioeconomic crisis. Next slide. Now, there are reportedly 3 factors that seem to be associated with deaths due to despair, and that are suicides as a result of drug or alcohol use, which is a consequence of rising unemployment. and social isolation. Those three factors are economic failure with massive unemployment, which we're getting right now, mandated social isolation for months and possible residual isolation for years, which is expected to occur with this pandemic as well, and uncertainty caused by the sudden emergence of a novel, previously unknown microbe. Uncertainty is a horrible thing for human beings. Our entire physiology is made up to reduce uncertainty and increase one's control over their environment. And unfortunately, with this disease, we have unknowns about its impact within each individual, within each racial group, within each ethnic group. We have unknowns. Is the healthcare system going to be available and have the necessary tools to help me if I come down with this disease so I don't die? All of these uncertainties can lead to fear. And if fear rises to the point of being catastrophic, leads to dread. And dread is what we're trying to stop people getting to, for that increases their risk of suicide markedly. Next slide. A recent study by Phillips and Nugent in 2014 were looking at past unemployment catastrophes. And what they were able to identify is that for every 1% increase in the unemployment rate, it increases the suicide rate by 1 to 1.6%. When you're talking about over 300 million people in this country, that can be a significant number of individuals who are at risk of death as a result of unemployment. Next slide. Now, this was done in a study they called the Projected Deaths of Despair from COVID-19. This is from the Robert Graham Center and Wellbeing Trust. This is a primary care foundation that was looking at, from their economists wanted to look at, well, what can we predict as being the possible deaths due to despair as a consequence of this disease? Now, they had to use different models. One model was, well, this will end in 4 months and we'll all be back to normal in terms of how our employment area will work. To this may go on for 6 to 7 years, as the Great Recession had. And by Great Recession this time, I'm talking about the 2008 recession that we've just been coming out of. And so looking at that, they actually looked at a 3-year period of unemployment that slowly but surely decreases over time. And what they found, as you look down at the bottom of this list, second to the last, are the risk of African Americans dying. It says we have a 44.6, there will be 44.6 deaths per every 100,000 African Americans that will be due to alcohol, drugs, and suicide. That comes to about 62,000 African Americans we can expect to possibly die if the unemployment downturn continues for the next 3 years. Next slide. In addition to deaths due to despair as a result of unemployment, African Americans are also confronted by barriers to accessing health care, which can also increase our risk of death. Some of these are African Americans have a higher rate of being less than high school education compared to their white peers. We live in food desert environments, meaning communities where you cannot easily walk or access good stores, markets that have good food and fresh fruits and vegetables. And African Americans have a higher rate of living in unsafe neighborhoods as well, which put them at risk of death and due to violence. Next slide, please. Other reasons. Right now, as you see, I do telehealth visits now, but for many African Americans, telehealth visits may not be a possibility due to a lack of internet connectivity. Now, I would say that much of the literature in this area is looking better and better and better over time in terms of African Americans having smartphones, having access to personal computers, looking at their emails routinely and daily. But there are areas we need to improve. As you see, for white Americans, about half of all white Americans have access to the internet. But it's about 35% of African Americans have access. We need to improve that. Actually, in the next few years, we need to have 100% access to the internet. It is essential for living today. And African Americans who do have access to the internet, they do go online, but at a little less than white Americans. And I do believe we need to help people learn how to feel comfortable in navigating the internet to find the information they feel is necessary for them at that moment, at that time. The good thing is we do seem to use email a lot, but again, email may not be the wave of the future for how people connect and chat. Next slide, please. In terms of insurance as being a barrier, it has always been estimated that African Americans have a higher rate of being uninsured, even unfortunately in the Obamacare era. And right now, this was done by the Kaiser Foundation, uninsured Blacks are significantly more likely to fall into a coverage gap than whites. We earn too much for Medicaid, but we don't earn enough for tax credits. That gap has to somehow be closed quickly and immediately in this time to ensure the welfare and the well-being of African Americans. But more than that, to ensure that African Americans feel like they can access health care rather than having to wait and push to the side deadly needed health care if they're having a cough or a fever. Next slide, please. What can we do in this state? We need to, in a very responsible way, begin to open up our society again to reduce the risk of deaths of despair. We need to make and expand our social connections and the organizations and circumstances with which those social connections can be expanded. We need to better support financially faith-based community organizations, nonprofit organizations, and we need to expand, as I mentioned before, internet connectivity for all Black Americans. We need to reduce homelessness through expanded housing. For even though the shelter is providing great service to help the homeless people need their own home to practice social distancing better, to feel they're part of this community and feel that they have a responsibility to not just protect themselves and protect other people, but to also protect their home. And we need to expand mental health care and substance use treatment and extend its reach into the community. We need to have more outreach services for, and I'm talking about physicians, to go out to people's houses again. And next slide. For African Americans, we need to maintain our social connections and even expand them, come up with different ways to connect with one another. That will also keep your brain challenged. We need to exercise to reduce anxiety and depression, behavioral activation, i.e. exercising, particularly cardiovascular, that raises your heart rate, like bicycling, getting on step machines, things of that nature. That increase in oxygenation to the brain can reduce anxiety and depression. We need to start doing things like meditation and mindfulness training to help us focus our minds on what we can control versus what we can't control. And if we're feeling overwhelmed, we need to reach out to friends to let them know and help support us. Or we need to reach out to the behavioral health services that are available within our state. But most of all, we need to follow all the safety recommendations that the New Mexico Department of Health have introduced to help us control the spread of this virus. And we need to participate in all forms of testing. Testing is important, not just to understand whether you have the virus or not, but to really understand how often do African Americans get this virus? And even more important after that, for those who do get the virus, what is going to be what we call the prevalence of death if you get this virus? Everything is being projected now based on models, which are based on the best guess we have. We need to have more concrete data to understand this. And last but not least, next slide. Next slide. Don't listen to everybody. Go to just places that have reliable information that's based in science. And as I mentioned before, those two places are the New Mexico Department of Health and the CDC website. I'd like to thank you. I hope that was helpful information, and I will be happy to answer any questions that were brought up.
Dr. Cruz, thank you so much for this great presentation. The information has been absolutely incredible, and I hope it's gonna prove useful to our listeners. It certainly proves useful to me as an individual as well. We've got a little time left, and so we want to go to our chat room, and I should have made that announcement earlier. If you have any questions or brief comments, please type them in the chat room, in the chat box, and we'll try to get to those now at this particular time. I do know that I saw a couple of comments, one from Sonia and one from Dr. Martin as well. So while we're waiting for you to type your comments in, Sonia, you had something you wanted to share?
Yes, Dr. Cruz said that he didn't have any information for New Mexico specifically. So I just wanted to kind of fill that gap a little bit. On our dashboard on the Department of Health's website, there is some information. But if you want to dig down a little deeper with that, there is more detail on the Johns Hopkins website. So I went there this morning to make sure that what I had was accurate. And to date, in our community, we have 168 positive cases. And a couple of weeks ago, when I checked with our epidemiology department, we had 2 deaths in our community. But I still need to go back and get more information because, as you know, we have to confirm that through death certificates. So I just wanted to make sure that I shared that information.
That's helpful.
Great, thanks so much. Thank you. Dr. Martin, did you have something? You did note the importance of health promotions and disease control measures.
Well,
illuminate on
I'd like to change that comment really.
that? All right.
I would like to say that thanks everybody again for the illuminating information that everyone has brought forth in this particular conference. And I just want to say that as we think about this, I want to say a little bit about the public health aspects of all of this. And it's important to remember that pathogens such as SARS 2.0 are natural. These pathogens are natural. Epidemics and pandemics occur through human behaviors that spread them. It's also a factor of weak policies, institutions, and weak leadership that fosters these disasters, as you alluded to earlier in terms of governance issues in response to this. And so a colleague of mine has coined the term pandemic amnesia. As we talk about pandemic amnesia, you have to remember that the US, we suffer from this collectively. It's a toxic combination of underestimating risk, insufficient and inadequate protections. And so this is not the fault of individual human beings. We live in a toxic environment. We have institutional racism. There's excessive oppression due to excessive racism, oppression, injustices, materialism, and militarism. And these are all threats to us, to our lives. And so we have to remember that hashtag equity flattens the curve. We may have some opportunities to abate and mitigate the circumstances of this pathogen, but the pre-existing conditions that put African Americans and others in harm's way are still there. So that's why we have so much neuroticism and worry and anxiety, irrationality, and vulnerabilities, which are very strong predictors of this. So we have to change the system in which we live in.
Right. Thanks for that, Dr.
So
Martin.
they work upstream with policies. And so vote and vote responsibly.
Oh, absolutely. Absolutely. Tanya Covington.
Yes, thank you all who joined this podcast and listen to this very very informative information from Dr. Cruz. We also want to remind you to keep spreading the word about this so that other African Americans throughout the state can join us every Monday morning at 11. And we want to say that next Monday, the 25th, is Memorial Day, but we are still going to have a podcast. And on that day, we will have Dr. Lisa Taylor talking to us about pre-existing conditions in the Black community. And then the following week on June the 1st, we're going to be talking about mask making. We're really going to encourage people throughout the state who know how to make masks or can donate materials or can help with distribution to join that call, because we want to make absolutely positively sure that every African American who wants a mask has access to them. So again, thank you all for being here, and we will continue.
Thank you, Tanya. And this concludes our topic on Black mental health. Today, we'd like to again thank Dr. Mario Cruz and all the other participants on today's panel. Sonia, special thanks to you as well. If you'd like to watch the replay of today's podcast, it will be posted on our YouTube channel, Office of African American Affairs, beginning tomorrow. As Tanya mentioned, next week, Dr. Lisa Taylor will be presenting, and we hope you'll call in or dial in for that one as well. And as Dr. Martin has always suggested, probably the #1 pre-existing condition for African Americans in the health arena is being Black. And that's a very important one to not lose sight of. So next week's going to be a really interesting topic, and we encourage you to call in. Thanks, everyone. Thank you to the Office of African American Affairs for another great opportunity to share with you, and we look forward to joining you again next week. Goodbye, and stay safe and stay healthy.
Thank you, Jim. Thank you, everyone.
Thank you. Bye-bye.